Before we get started today, I want to make sure that we provide a bit of a disclaimer. I am not your therapist. Again, I am not your therapist. And our guest today is not your OBGYN. Any information provided today does not take the place of you doing your own research and consulting with your medical providers. We encourage that you discuss the information provided here today with your physician and explore the best options for you based on your own individual medical needs and treatment goals. Additionally, this episode contains sensitive material and may not be suitable for children. Consider yourself advised and officially welcomed to Intimate Details with Dr. And seasons, we've gotten to know my guest, Dr. Jackie, on Bravo series Married to Medicine. But the reality is, Dr. Jacqueline Walters is a board certified OBGYN, an author, entrepreneur, wife, philanthropist, host of her own podcast, Dr. Jackie's Point of View. When is that coming back, by the way? And so much more. Welcome, Dr. Jackie, to Intimate Details with Dr.
Well, hey, Dr. Tiffany, how are you?
I'm good. How are you?
I'm amazing. You know, it's Monday and everything
It is.
starts the top of the week, but I enjoy,
We're
but
blessed to
it's a
see
good
another
day.
Monday. It is a good day. Any
Absolutely.
day you wake up on this side of the dirt is a good day.
It's a good day. Absolutely.
It's a
And when I get to
good.
see your lovely face, it's a
Well,
better
guess
day.
what? Guess what? You're gonna see me twice this week. Okay, you're gonna see me today, and you're gonna
Okay.
see me Thursday. Praise God.
I'll be there.
I hope so. I hope
Yeah.
so. Well, I'm sure my listeners want to hear all about what's going on with this new season of Married to Medicine, but you know that I brought you here for something very specific, and that is not it. Today just feels like a great day to talk about orgasms. One of my favorite
Ooh.
subjects, and I could not think of a better person to have this conversation with than you, the queen of the
Ooh,
V,
girl.
the
The
queen
queen
V.
of the V and the queen of the O.
Yes. Now, as our listeners are aware, I'm a psychotherapist specializing in sex therapy, and you're someone who sees a very diverse range of female identified patients with all types of medical and gynecological concerns. And I think one of the similarities for us is that we both work with women who complain about problems in the bedroom. How does that show up in your office?
Well, Tiffany, they typically come in and say, Dr. Jack, I have no libido. I'm like,
Mm,
no libido or low libido? And they'll say no libido. And that's when I start thinking about you, Tiffany, because the first thing we think about when there's low libido and no
mm-hmm.
libido is what's going on in the head.
What's
Because
going
that's the
on? What's going on?
biggest sex organ we have
Right.
is right there in our head.
One of the
And
things
we
that's
don't
so
say that to,
great. Go ahead. Go ahead.
no, and we're not saying that to say it's not real, because it's very
Mm-hmm.
real.
Mm-hmm.
What we're saying is what else is going on inside of that sex organ in your brain that could be hindering it from firing to where it needs to get to.
That makes you not want to have sex, because sexual desire is just that. It's your motivation, right, to be sexual, and
Mm-hmm.
something is making you unmotivated. And a lot of times, sometimes it is physiological, but a lot of times it is more of the psychological stuff. It's the person that you're having sex with that makes you not want to have it. There are plenty of those reasons, but it's interesting that you go there with this, because one of the things that I love about you is that I know that you talk to your patients. You talk to your patients. And I'm always
Mm-hmm.
so amazed at how many doctors aren't comfortable initiating these types of conversations with their doctors. And I know they're not comfortable because we don't see these questions in intake forms. We don't get asked those questions when we're sitting down with our doctors. A lot of times they don't prod us for that. And we also see it, I know that, because they refer out when they're not comfortable
Right.
talking about something or dealing with something. And it might even be something as simple as an easy lab draw. They'll just say, okay, well, I need you to go somewhere else, because I'm not going to, we're not
Right.
having that
Right.
conversation. So I so appreciate that you can initiate that conversation, and not only initiate it, actually take a minute, which is really hard in today's healthcare system, to take a few extra minutes with your patients to say, okay, tell me a little more about what's going on, because it's not just low sex desire.
Right. Right. And we do have to ask all the hard questions. Is it, like you just pointed it out, is it you don't really enjoy your partner? Are you unhappy there? But then we, I pivot away from those moments because if it's a lot of psychological stuff, we do send them out. But if
Yes.
you start saying like, uh, I have sex, but I don't feel like having it. I have no energy, or I'm not having my period. We prod them. So we start checking hormones. And what are hormones?
Yes.
It's the body's chemical messengers. It goes from a gland to the intended organ to stimulate the organ. So, for example, if you're not wanting to have sex, I'm going to check estrogen levels. I'm going to check
Thank you.
testosterone levels. We're going to do things like FSH, follicle stimulating hormone levels. We're checking to make sure you are chemically okay.
Yes.
Once we exclude that there is not a problem with the chemicals, then we start digging deeper into the psychological side of it. But I will tell
Mm-hmm.
women, as I have aged, and I like to call it matured,
Yes.
things
Amen.
change. You know, the
It
word the
does.
change
Uh-huh.
is really a
It's
change in life. It's a
all
transition.
encompassing. Yes,
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 yes.
yes. It's not just I don't have a period anymore or I can't get pregnant. It's
Mm-mm.
every from the rooter to the tutor, every
To
aspect of
girl, you
yes,
took my
yes.
words. Yes. So when you're going through a perimenopausal phase, which is in the
Mhm.
mid to late 40s, and
Mhm.
your ovaries are starting to decrease the amount of estrogen and progesterone production, things change. And
Mhm.
estrogen is
Mhm.
so important from the brain, literally from the
Mhm.
rooty to the tooth. And
Yes.
so when the
Yes.
brain changes and then the vagina starts to change and then sex is uncomfortable and then
Mhm.
there's so much
And folk getting on your
happening.
nerves.
There's some
Yes.
moodiness that's happening,
Mhm.
and we're quick. You know,
Mhm.
when your grandmother was quick to say whatever came to her mind
Uh-huh.
back in the
Uh-huh.
day, you
Amen.
start to see that
Yes.
happening. And so, as a woman, we're changing
Mhm.
completely, physically,
Mhm.
emotionally, spiritually. We're
Mhm.
changing,
Yes. Yes.
but
It's a
we
part of
don't
the
want to
evolution.
deprive ourselves of a good quality of life because we're changing. It's
Right.
time to have good sex. You're not having a period anymore. You should be
I
having good
mean,
sex.
that's the thing. Cause this is the thing. You're so right. Like in your earlier, late teens, early 20s, 30s, is you spend so much time trying not to get pregnant. Then you
Yeah,
have this small window of time where it's just like, oh boy, this clock is ticking. I need to go ahead and get pregnant if I
and get
can,
pregnant.
right? And
Uh-huh.
then you get into that phase of, Lord, I hope I don't get pregnant again.
Right,
And then
right.
once you get to the point where ain't no chance of me getting pregnant, like you don't even want to have sex.
And that's not right.
And that ain't right. It
Now,
ain't
let's
right.
qualify. If you don't want to and you're good with it, you don't want to. We're not saying
Correct.
that's not right.
Correct.
If you want to have sex and you don't feel like having sex or you're not having good sex, that's
Mm-hmm.
where we
Mm-hmm.
come in.
Absolutely, absolutely. And so there is a large group of women. I'm so glad you brought that up. There's a large women group of women that I see that will say, I am not having sex with my husband. I don't have a desire to have sex. I don't have a desire to have sex. I'm
Mm-hmm,
good.
mm-hmm.
And so I'm like, well, what are we doing here? And when you start to peel back some of those layers, though, you do find that the desire isn't necessarily there for the person that they're partnered with. And
Mm-mm.
then we have to
Oh,
start
Tiff.
looking at the why. What is it that your
Yeah,
partner is doing or not doing that's causing the desire to be low?
absolutely.
And that could be a
Absolutely.
myriad of things, it could be
And,
anything.
and so this case is where we've done your complete workup and we
Yes.
found you're
Yes.
either perimenopausal or menopausal. And we definitely have fixes for those. If your
Mm-hmm.
estrogen
Mm-hmm.
levels are low, if your testosterone levels are low, we have a fix for that. And if we
Mm-hmm.
replace what's missing and you feel better, then it was a chemical problem. Your
Right.
hormones were off. But if
Right.
we replace that and you still look at him like,
Mm. Mm.
then it may not necessarily be your hormones.
Right. Right. Because sometimes the vagina is responding in a way that it should based on what's going on. You know,
Yeah.
our vaginas definitely talk to us, and sometimes they dry right on up when the situation ain't
Mm-hmm.
quite right. And it's not
Mm-hmm.
that you have a difficulty with lubrication. Now, again, we refer out to you for that, right? To make sure that the plumbing's
Absolutely.
working properly. But when I hear that, lubrication is it's good when I do this or when I'm with toys or when I
Yeah. Yeah.
but not in this case. Well, then I know it's working, and we got to figure out why it's not working in this scenario.
And Tiffany, that's one question I do ask women. I say, well, can you have an orgasm if you do a menage
Mm-hmm.
a moi? If you're doing
Uh-huh.
yourself,
Yes.
then does it work? And they go, well, yeah. Well, there's nothing
Okay.
wrong with your
Yep.
orgasm circuit. It's
And that's what
working.
I get the call. The
Right.
plumbing is working. The plumbing is working, but there's something else going on. And that's always so important that we look at that. And then speaking, of orgasm, and that's why I wanted to talk to you about that today, because so many women, women in particular, want to reach a greater orgasmic potential. And I'll tell you, when I was researching this topic today, I'm looking at the numbers, and really it's all over the place. Some of the studies said 21% roughly are
Mm,
experiencing this. Others said 16%. One study said 68%. I imagine that those numbers are all over the place because of what we discussed before, because people aren't necessarily offering up, volunteering this information to their doctors if they're not being asked. And then also, some of our physicians just aren't asking the right questions to figure out what's going on with their patients in a sexual
yeah.
way. Yeah,
Yeah.
it's
And
really
and
hard.
I'll take you back to Tiffany. You remember I actually had you to help me with the Queen Bee. We came to
Yes,
you. But
yes,
in that book, we wrote that the vagina has personality.
sure does.
And we don't mean your vagina is literally got a personality, but it really is about you and how you
Mm-hmm.
respond to
Mm-hmm.
sex and feminine health. And so for some women, if we approach them about sex and feminine health, they quieten down and they talk real soft in the room
Mm-hmm.
and they cover their mouths and they'll grab their clothes. And those women don't really want to talk about it. So that's the hard
Mm-hmm.
part for
Yeah.
the OBGYN is figuring out
Right.
how to approach this patient about it.
Right. And
For
you're very
others,
matter of fact, though. You're very
yeah,
like, you don't have time to tarry. And I know you're a busy doctor.
mhm,
You make time for your patients, just like you're making time for us today, right? But
absolutely.
you don't have all the time in the world to hem and haw with people. You're a very direct person, personally and professionally, which I appreciate.
Yes.
I need that in my life. Um, but it's, for some, I would imagine it's like pulling teeth to say, like,
Oh,
just let me
absolutely.
know what it is, because what you're there to do is help. You're there to help. You got
Right.
to tell me what the problem is, though.
Right. And when you start to peel back the layers, though, you really find out that it's deeper than just what they're talking about in a lot of
Oh, yeah.
cases. It's
Mm-hmm.
upbringing, it's
Mm-hmm.
sexual experiences you've had
Mm-hmm.
or the lack thereof. So,
Mm-hmm.
really, we have to peel back layers to figure out what do we do with this patient, and whether I send them to Dr. Tiffany or whether I need to draw labs. We do have to find out what is going on with the patient. But I
Absolutely.
just want every woman to know sex is for both parties involved.
Mm-hmm.
A good pleasurable encounter is not just about your partner. And a lot of us have been taught
Exactly.
as younger women that it really is about the man
Pleasing your
or
man,
the
pleasing your
woman,
partner. Yes.
whoever the other partner is. But it really is about both pieces. So one, get to know who you are. Study
Get
your
to know
own
what you like.
anatomy.
Yes.
Know what feels good and what you like and don't like, and where to touch me and where not to touch me and what turns me on.
Mm-hmm.
And be open and honest with your partner. Like if you don't like him blowing in your ear, tell him.
Better say it, because he gonna,
That's
if you wiggle away, he think that wiggle means something good. He gonna keep doing it.
You're
Keep
gonna
it,
keep
keep it,
going.
keep it on.
Right.
Yes,
Right. And so in order to
absolutely.
set yourself up for a good orgasm, you got to be honest with your partner.
Mm-hmm.
Like that doesn't
And
feel
then,
good or that doesn't make me feel
mm-hmm.
more sexy or whatever. You got to be honest.
And I feel like nothing's sexier to a partner that wants to please you than you just whispering in their ear and telling them what you want them to do to you. Like, they love that. They love
Do
that. Just
you
tell
think
them.
they're like that, Tiffany? You don't think men or partners will say,
Mm.
I know what, no, they like it?
Test it out tonight, Dr. Jackie. Just gonna test it out
Okay,
and get
Tiffany,
back
I
to me
have to say
tomorrow.
the doctor prescribed this to you, baby. Come on.
And let me know. I'll see you on Thursday. You can let me know how it worked out for you. There we
Hmm.
go. Deal. All right. So we're talking a lot about orgasm today. can you describe, because it's such a hard thing to describe to people what it is. What is an orgasm?
It is almost this build up of, if you ever, I mean, let's see how we can make it as layman as possible. It is this build up of a big release.
Yes.
Blood is
Yes.
flowing to the genital organs, and you feel like you're about to jump off a cliff. And when you do, it's like a,
When you jump off that cliff, you're floating on air.
oh my goodness, it is. And it's quick and it's fast, but when it's there,
Mhm.
it is, everybody
Mhm.
responds differently.
Sure.
Some of us have been taught to be real quiet. And then you have that girl who was in the room next door to you who's screaming and hollering and banging on the walls. So everybody's a little different. So there are phases to it where there's a
Mhm.
build up, then it
Mhm.
happens, and then there's a kind of a quiet letdown where you just feel like, oh. And
Yeah.
there's studies to show there's a lot of chemical uh, neurotransmitters and things firing when that's happening, where you just feel better.
Yes.
And there's
Yes.
this release, and the body is
Mhm.
relaxed. And a lot of people say they fall asleep.
A lot of people do. Guess what? I don't. I be up. At that point, I'm
Tiffany.
up. Now my husband's over here. He's knocked out, snoring, everything. Like you cannot move him. I have to turn the TV on. I can't go back to sleep. It take me probably
Mm.
another hour to go back to sleep. I can't. My mind going. I might need a little
I get
snack.
about a 3 minute nap now, Tiffany. About 3 minutes.
Not at all. Not at all. Mm-mm. I'm
Mm.
up. At that
But
point,
what
I
we
am
made a
up.
point now is everybody's real different.
Everybody is so different, and that has nothing to, like, that's just me, and I cannot fall back asleep after that. I'm gonna need a little snack.
But I will tell women what has been new, and you may have seen this on Married to Medicine or
Hmm.
not, because we did a whole O shot night.
Now we getting ready to talk
Girl,
about that. We getting ready to talk about that.
yes.
Okay, we're getting ready to talk about the O shot, because, and so before I move on to that though, I want to make sure that we're clear. There are so many different things that can cause that can cause someone to not be able to orgasm. I'm dealing with more of the psychological stuff. Could be past trauma, could be anxiety, could be difficulty letting go. One of the things, really interestingly, Dr. Jackie, one of the things that I find with women, that come to me and say they've never had an orgasm, or they
Hmm.
can't find it, or it just won't come for them. Um, a lot of times I see it in women who suffer from, who are very driven, um, really have a hard time allowing people in and letting people do things for them. They
Mm.
tend to be people who, need to control things
Mm.
and really have a hard time letting go. And what you just said, it makes perfect sense. Orgasm is letting go. You have to
Yeah,
allow yourself to let go enough and be free enough to let it out. And
right.
so what we work on with women, with those types of cases, is really starting to let things go in their life outside of the bedroom,
Mm.
because it translates. It's a skill that translates. You start trying to do that at work, because usually they hoard things at work. They have to be in control. They have to be very measured. They don't trust too many people, let too many people in. You start doing that in other areas of your life, it gets a little bit easier to do that in your intimate space as well. This season of Intimate Details is all about pivoting. And
Hmm.
as we've been talking about, especially post pandemic, we've got women who are pivoting in their sex lives as well. They've said no more. We're not going through the motions of sex anymore. We don't want to miss another opportunity to orgasm. I need to do whatever I need to do to be happy in the bedroom. It's no longer about pleasing my partner. I want to get in on the action. So let's go get to the good part. Let's start talking about this O shot, because we've heard, yes, Mary, yes.
Yes.
We got questions. The women, the girlies have the questions. I know that your Medi Spa Wow Aesthetics offers the O shot, and that is
Yes.
why I want to talk about married medicine. I want to talk about this O shot.
Girl.
Um,
So
it's a
listen.
shot. It's a shot,
Uh-huh.
right?
Uh-huh. It's
And
a shot.
it's in the vagina
It is in the vagina and other parts of the external genitalia, so clitoral.
with a needle.
Now let's qualify because you just made it scary. So
Because I'm
basically,
scared.
yes,
Because
but
I'm scared.
basically, what we're doing is giving you back your own platelet rich plasma, PRP. And
Mhm,
in that plasma are a lot of growth factors, and
mhm,
it increases blood flow and nerve innervation in areas where you want more uh, innervation. And so we draw blood, we
mhm.
spin it down, we get your PRP. When we put it back though, we do things like numbing cream first.
Okay.
So that, when you go to your dentist, before they stick you in
Yes.
your gums, they
They do
actually
the
put a
little.
numbing cream there. So we do the same thing. We put a numbing cream there. And oddly enough, we will also put ice there to paralyze those nerve endings. And so very few people say, ouch. I promise you,
Mm.
very few people say, ouch. And
You're
so
one of
we
the few
prepare.
people that's been with me and seen things in my vaginal area, and
Mm-hmm.
I say ouch all the time. I believe I have a very low tolerance for pain, and I have anticipatory anxiety of a needle going to my vag.
Okay, but you won't feel it. You won't feel it. And I'm doing
So,
so much other stuff to you. If you actually are tapping, you will distract the patient. Vibration will
sure.
distract needle sticks. So we get
Okay.
them to a place of comfort where they don't even know
Of
that they're getting
relaxation.
it. Yeah. And yeah, and what they discovered, the
Yes.
doctor who actually discovered the O shot, he was really trying to treat stress urinary incontinence. You know that little squirt squirt
Mm.
you get when you cough or sneeze.
Mhm.
What he found is when he did that, women were coming back saying, Doc, I'm really having these orgasms more. What is going on? And he
Interesting.
discovered putting this PRP back into these places, what some may call the G spot,
Yes.
and in the clitoris, it heightens that sensitivity where I promise you, Tiffany, some women said, I squeeze my legs tight and it just fires.
Who has time for that though? I got like grocery shopping to do. I got to
No,
reach
Tiffany,
out
this
for
is sitting,
carpool. I got things
no,
to do.
girl. Okay, so we're
I
being
mean, am I
open
going to
and
be just
honest.
walking? Yes, please, because if I'm going to be like out and about doing my
Mm-hmm.
doing my business, and I just start, doing a minor Kegel exercise as I'm walking the dog or something, am I going to have an orgasm while I'm walking the dog?
You just may. And so only for you, Tiffany, will I tell you, when I
Okay.
first got the O shot,
Yes.
and at your OBGYN, we straddle a stool
Yes,
in
yes,
most
yes.
cases.
Yes.
Tiffany, I sat down on the stool. I went, woo! So I had to get up off the stool. Then I tried to
Hold on,
cross my
wait a minute.
leg like we do as women. And I went,
Yes, yes,
woo! I
yeah.
tried crossing the other leg like that, Tiffany. And then I said, wait a minute, I can't touch it. Because if I
Uh-uh.
touch it, it's going to go.
Oh boy. Oh
And that
boy.
baby was so sensitive initially that I was having headaches because I'm like, I need to have sex. I
And
promise you.
you mean to tell me that if you thought, you think that if you didn't whisper that in Curtis's ear, he not gonna be like, all right, then come on, let's go.
He's not at the office. I
It
am at
don't
the office,
matter. Call his
fully
ass.
in scrubs.
You got a lunch break?
Girl, have you seen my husband? Where am I going to take my husband in the office?
I don't know.
Right. His shoe 7 feet tall, almost girl. So you would just have to get up off the stool. And then I found myself
Listen,
sitting to the side like
to the
this.
side. You
Uh-huh.
got to
So that
cross your
I
leg
did
from the
not.
fat part, honey, where your hip just come on up and everything else just
Yes.
Listen, I don't know
So
if I need that in my life. That's a lot.
is it, but for some women though,
If
if
you're
they're
not
not,
experiencing orgasm, if it's really if it's it,
well,
yes.
no, no, no. Now let's correct it. If you've never had an orgasm, we're not going to make one. If you
Okay.
want to increase the sensitivity,
Great. Great.
then we
Great.
can do
Cuz
that
that was
for
my
you.
next question, like who is this for and what can you expect afterwards? So you mentioned better orgasms, right? You also
Hmm.
mentioned better control, better like bladder control
Bladder
or
control, right, right.
yeah. So, what other
Right.
benefits are there? Because there may be women who say, well, I don't need it for that, but there may be other things that can positively occur by getting the O shot.
Now, I had two of my castmates share on the show, so I can share that they became very moist.
Hmm.
Now, I'm like, were you moist because you were turned on? Because I'm not giving them anything, to hit
Right,
those. They just
right.
became very moist.
So I would expect that maybe that, and you tell me, you're the physician.
Hmm.
Maybe the sensitivity in the area increased, which caused more of those nerve endings to just kind of start to fire off and make, we think of the vagina as kind of this self-cleaning oven, and this it kind of self-regulates in some ways if things are if the pH is right and things are operating in optimal fashion. So maybe is it that the platelet rich plasma allows for the vagina to operate as it should, almost as a balancing agent and making things act as it's supposed to, an
Yes,
adaptogen.
I think you're yes, exactly what you're saying. You're turned on. I mean, when you feel that
Mm,
sensitivity in the clitoral vaginal area, you're turned on. And when we're turned on, the brain starts to fire, and then,
mm-hmm.
it is no
Yeah,
longer moist. The same things that can dry us up, those
yeah,
things that turn us on can turn us on, and now the vagina is moist.
yes.
And so it's good
Very.
for 18 to 24 months. So it's not something you have to
So the
keep
one
coming
shot
to.
is 18 to 24 months?
Absolutely. You don't have to keep getting that.
Huh.
So,
And
Tiffany, you could bear.
don't even start. Does it stay potent the whole time, or is it going to just start to wean off after
uh,
like month 10?
Personally, I think it tapered off to my benefit because it was too much at first.
It was too much.
Yes, I couldn't sit on her. I
I
couldn't cross my
know.
legs to her because, I tease him with the clitoris like it looks like a little man in the boat was just in control. And so yeah, I believe it tapered to a more controllable place where I didn't feel like I couldn't squeeze my legs and I couldn't sit on
Yeah.
straddle the stool.
Does that like the amount of platelet rich plasma that you inject, would you then, like, on your next visit or your next dose, would you dial it back because you're super sensitive, or is it just one dose fits
Well,
all?
we definitely don't go up. We don't want to cause
Okay.
any trauma to any of that tissue. Have I had some patients say, give me just a little less? Because what we've done for some patients that have come in and they didn't feel like they got everything, we follow you for a while and we will do a little boost dose.
Mm-hmm. A little
But we
booster
definitely
shot.
don't, yeah, girl, a new name for a booster shot. But what I can say to people, and I'm probably the Mary Jane vaginal personality where I'm,
Mm-hmm.
real even keel. I
Yeah.
can tell you, it really was like the problem I had with it, since we're being honest, is it
Yeah.
went too fast though, because you started touching her. I was like, boom, all
Yeah,
right.
you ready to go. And
No, but
I
I didn't have to last. I didn't have to go long.
yeah, yeah, yeah.
Yeah,
And I do like the love making to linger. I like it to
yeah,
linger. Now, I ain't trying to be up all night, but
right.
I don't want to, like, you touch me once and then that's it. Like, but what you're saying is as soon as you put the car in the ignition, it's go time. We don't have to warm
Well,
things up no more.
you have to practice things like, with a man, we got squeeze technique. So with a woman, it
Mm-hmm.
was like, you have to pull back, you know,
Yeah.
and let that
And let it
baby
wait
just
for a little bit.
relax.
Yes. Yes.
So you building it up, and then eventually, Tiffany, you start seeing sparkles, and your mouth is moist, your vagina's moist, and you start making noises, girl. She works. She
She
works.
works. She
Yeah.
works. You hear
You need
that?
to let
She
me know when
works.
you're ready to get yours so that you can not just hear
You're
about it, but you can be about it where you're going, whoa,
trying to challenge me. Here's you challenging
girl.
me.
We're taking you to another level, Tiffany, as we're transitioning in these
Wow.
different phases
Yes.
of our life. A
Yes.
little
Yes.
extra, people do
A little
Botox and
extra.
fillers all the time. The
Yeah.
other thing that is happening is as we are maturing and we're reaching that perimenopause to menopause, you start to lose volume in the lips of the vagina, in the labia.
Yes. Yes.
And you start to get a little clitoral atrophy. So you need to give that back to yourself because it has a purpose.
And collagen just won't do it.
You can put a little bit of filler, just a little bit, into the labia, into the lips,
But see,
and
that's
it'll give you a
alien.
little plumpness.
Yeah, and I so my freak out is more so the needle. That's what I'm freaking out about. But you're saying the area is numbed, so it's not a thing. I just have to get out of
No.
my head. I don't feel, just for the record, ladies and gentlemen, I don't feel that I need it, but it might be nice to have. Might be nice
You
to
may not
have
know
any
what you're
old quart
missing,
or two.
Tiffany.
I may
Yes.
not. I may not.
Yeah.
And how am I gonna know if I don't try it?
Bam.
So
You
so
answered your own
listen.
question.
So listen. So here's the deal. If you guys, if we do another podcast episode, the video episodes, which you can listen on Spotify, for watch on Spotify, watch on YouTube, and y'all see me wiggling in my seat, okay, and you see me sitting like this on the side, it's because I had the O shot and I'm trying not to have
Let
an
me let me
orgasm on
challenge you
on
even
the
more, Tiffany. Why
podcast.
don't we
Yes.
video getting it?
No.
We won't actually video that part, but we just like to see them see your face, and they'll see it's
you are
painless.
you are doing the most right now, and I'm gonna need you to stop.
But Tiffany, I
I
mean,
know. Listen,
it
there's nobody else that I would trust to A, have this conversation with, or B, do that. No one else is sticking anything up my vagina, okay? You are it. You, my husband, that's it, okay?
because this is
But
what
I
women
I
need to
need to
know.
pray about this. I
Goods,
have to
but listen,
listen.
do we need to do it now?
Yes, ma'am.
hmm
No.
Dear God, give. Okay, you don't want to pray about it now, because
Yeah,
I'm like,
okay, we
we
can
want,
pray. Come on.
you know,
I ain't
God.
never gonna turn down a
You
prayer.
know
Let's
what,
go to God,
dear
honey. Let's
God,
go in the closet.
sex. Listen, sex is for recreation and procreation, and at this point, if women who are excited about recreation when it comes to sex and safety, give
Amen.
Tiffany the wisdom and the strength and the know to just come on in there and get her OSHA.
Oh my.
And Lord, just add a little extra to her OSHA. Yes,
Oh my. We're
Tiffany,
saying
I'm telling
amen to
you,
that. Are we
amen to
saying amen?
that.
Amen and amen.
Amen.
Okay.
Amen,
Well,
Tiffany. Because this is what women need to
yes,
know.
ma'am. Okay.
Sex is for recreation as well.
As
It,
procreation, you are
you know,
absolutely right.
yes. And if you're not trying
Absolutely
to
right.
procreate, you should be having sex for recreation.
You should be. Everybody should
And
have
what
great
better
sex.
person to have good sex? Yes,
Everybody should have great sex. Everyone is entitled. Everyone deserves great sex. And if you're not
right.
having a great sex, there are things out there that you can do, like this O shot, that will give
Yes.
you apparently the greatest sex you've ever had. I am so I you have I don't have nothing else to say. I don't have nothing
Let
else
me
to
tell you.
say.
Then we're gonna give them a concoction, Tiffany. We're gonna check your testosterone level and see if you need a little extra because everybody's testosterone level is dropping. Men and women as they age, they
Yes,
can have
yes,
testosterone pellets if appropriate.
if appropriate.
Yes. And you
Okay.
give back that testosterone and give those ladies an O shot. And if you need a lubricant, I have non-estrogenic lubricants that'll help you with the slip and slide. That is a recipe for great sex.
That sounds like a picnic basket. Sounds like I could
Girl.
just put it all together and just we can have an afternoon delight.
Good.
Afternoon
Absolutely.
delight.
Absolutely. And I
She's going to
really,
be very
and you're
happy
Tiffany,
that we talked
but
today.
Tiffany,
Yes,
you
ma'am.
are you are all about great sex. And I
I
think
am.
that
I
women
am.
need
And
to
I'm having great
understand.
sex. I'm having great sex. And that's why I don't want to do nothing that jeopardizes that. This sounds like it would actually enhance what's already great. And for those that don't have great, they have good enough. We don't want it to be good enough. We want it to be great. So I
Great.
love what you're saying. It's just I got to get over that needle. I got to get
Right.
over the
And
needle.
so for your listeners out there though, we want them to know if they're not having great sex, that you're trying to give them the tools to get
Hmm.
to great sex.
This is
And
this is
sometimes we
that
have to
answer. Yes.
Right. We try to talk them into a concoction, and that's what I was referring to. So your
Yeah.
libido is low. Well, let's check your testosterone level. If it is low, we optimize the testosterone level. All right. So we got you now in the mood. But sex is
Yes.
kind of, I didn't get a good orgasm. Now we talk about an O shot. And we
Yes.
give you back your own platelet rich
Mm-hmm.
plasma. So we're not
Right.
using somebody else. We didn't buy it anywhere. We take your
Right.
own growth factors in that
And I
PRP.
like that. I do like that
Yes.
because so many
And we
people
give that back
we're
to
on
you.
enough medications. We're on enough. We don't want to
Yes.
take another pill. We don't want to have another like we want like if there's something that we can do that is our own. I think many women just don't know about this
Hmm.
and would rather go this route than to have to go talking about, whatever kind of hormone therapy or replacements or all that. How about replacing my own PRP
Absolutely.
in my
And
vagina?
then,
Yes, absolutely.
by default, if you are leaking a little urine, and if you've ever had a baby, ladies, and as you
Yes.
age and you start to lose that elasticity in the vagina and the urethra is kind of aiming down and you cough or sneeze and put a little pressure on it, squirt, squirt, you get a little squirt. We can, the O shot will help fix that as well.
So exactly. Okay, and this is the last question I'm at. I know I'm fixated on a needle because that's just me. But I think that people really do want to understand where this is
Hmm.
going, where the shot is actually going. So what we're going to do, we are going to put a graphic on the screen. We don't have it on there
Hmm.
right now, but we will put a
Uh-huh.
graphic on the screen to describe where the shot is going. But you tell me, where does the injection actually happen? What parts of
So
the
there are two
external
places.
genitalia? Okay.
Hmm. Two places. We put it in well, one, we have slathered you all up with numbing cream. We wipe
Hey,
away
love
the
it.
numbing cream. And then we put ice on the clitoris.
Hmm.
And then we put a little bit of lidocaine in the clitoris so that you don't feel much. Okay. And so while
Okay.
that is cooking and doing what it needs to do, we then turn
Hmm.
our attention to the anterior vagina where we believe the G spot is.
Yes.
So, it's an area that when people touch that and rub it and feel it, you get the ooh,
Hmm.
ooh, ooh that I talk about.
Yes.
So we then
Yes.
put the PRP right there, and you only put the needle barely in that tissue. And
Hmm.
so when we do that, we inject a certain amount of PRP back into this area, and it kind of goes there around the urethra, and it builds up that area, and it heightens the response in your G spot. And so, I don't know if it pushes it closer to the part that it needs to be rubbing on or whether it's
Hmm.
sending more nerve innervation there, but it works in that spot.
It
Once you've
works.
been injected in the anterior vagina, we put a little bit into the clitoris, just enough to give that growth factor back into the clitoral tissue. Because really, if you look at the clitoris, it looks very much like the penis. It has
Absolutely.
these
It's made
two
out of the same
muscles.
embryonic tissue
Yeah,
as well, right?
absolutely.
Yeah. So lots of
Absolutely.
nerve endings already, but you're just putting back what we might have lost.
And building it up more. And so,
Yeah.
just like there's an O shot for women, there's a P shot for men. Now, I personally don't want to do P shots. I haven't been doing them and I can refer you out,
Hmm.
but there's a P shot for the man and it believes to strengthen and gives it a little bit of length. So it strengthens and lengthens the male
What
anatomy.
about girth, honey? What about the
Well, it did not promise to give us girth. The strength, maybe there's some extra oomph in it, but it strengthens and lengthens the man. And so can you imagine an O shot and a P
mm,
shot?
no, child. I would never
Girl,
be able to leave the house.
you wouldn't. And the baby would be hooked on phonics somewhere else because she would have to go in her room. Yeah, yeah.
Get nothing done.
But if we
Oh my
just want to
gosh.
keep
So,
telling women great sex
right.
is important.
It's important. It's important. It's attainable.
Yes.
And thanks to you and thanks to other OBGYNs out there who are doing this work, it's actually accessible. So I
Absolutely.
thank you so much for breaking this down to me. Like, some of the information people may or may not have known. They may have just want A plus B equals C. I like the nuts and bolts of it. I like the factoids of it all and knowing where everything is going to go, so that when I walk in, I already know what's about to go down. So I thank you for all the information. And if you are here in Metro Atlanta, you have to go to Wild Aesthetics in the Metro Atlanta area to get the O shot, as well as it's a full Medi spot, so they can get
Absolutely.
all the
We have
things, right? You're
pellets.
doing
We need your testosterone pellets. We have Botox.
oh,
We have fillers. And you can actually put fillers into the labia now to give you back those plump lips that you had
oh
before you
yeah,
aged. It's called
yes,
the wing
looking
lift.
juicy.
Yes.
Oh,
Yes.
okay. I'm gonna have to have you come back and talk about that next time after I get through the O shot. We'll talk.
Yes.
Well, because that's gonna take a minute. That's gonna take a
So
minute
are
for me
you
to digest
agreeing to
that.
your O shot right now so that all your
I'm not agreeing
listeners
to
are
anything. You know
okay?
what? I told them how they will know if I got it. Okay, and you and I will discuss if I can actually. I don't know that I'll be able to. 'Cause,
You have no medical
Doctor,
contraindications to the O shot, Tiffany. This is your own blood products we're
I
giving you back.
know, Jackie.
Mm-hmm.
We'll talk. Okay, we'll
Okay.
talk.
You will
Okay, we'll
love
talk.
it.
Okay.
You will
I don't
love it.
doubt that I will love it after it's over. It's the process for me, but I do believe that there are women out there stronger than me
Mm-hmm.
that would that really do need this information and will be happy to just line up outside of Wow Aesthetics in
And we
Columbus,
see them
Georgia
all the
and
time,
get
and
this.
nobody is
Yes.
screaming or yelling or crying about it. They're just like,
I'm sure
oh,
I'm a baby. I will be the first to admit I am the biggest baby. So I just got to get my mind right. And
okay.
you have done the Lord's work today. You have prayed with me. Okay. You have explained the ins and outs. You have told me everything that's going to happen. You've given me the physiological things that are happening and why this is a good idea. I have no doubt that this is a phenomenal procedure. I just got to talk myself into it. My
Okay.
vagina is probably okay with it. It's my brain that has to catch up.
Right. And your vagina is
Jesus.
screaming out, come on, Tiffany, give it to us, girl.
Is she screaming or is she whispering in my ear? Because you know
No,
I like
she is
that.
really screaming at you. Come on,
Ooh.
Tiffany.
You know what?
Yeah.
I'll let you know. I'll let you know on Thursday if I'm gonna do that. And that when I see you
Okay.
on
Well,
Thursday, it's gonna be a or a
right. Well, listen,
yes,
we ruled out all the hormonal problems. We know that you're
yes,
fine in that area.
yes,
And just
yes.
to give you that extra oomph. Now, I'll be honest,
Don't
if
do
it's
it.
not broken, we don't fix it. So we tell you if you
Yeah,
don't need it, don't do it. But if you want to be more sensitive in that area and have better
mm-hmm, mm-hmm.
intercourse, more intercourse, then this is the thing for you. Or if you're leaking a
Okay.
little urine when you cough or sneeze, here we are.
And that's big. That's huge for women. That's huge. That
Yeah.
right there sells a shot. That right there
Yep.
sells a shot. If we're not having the sexual issue, but we are having that, that sells the shot. That's worth it. That is so worth it. Well, listen, I've learned a lot. I'm sure our
Yeah.
listeners have learned a lot today. We love you down. We love having you here on the show. I hope you will come back. Can you
Absolutely.
please let us know about the return of Dr. Jackie's Point of View? When is that happening?
We're not, right now in film season. I can definitely say that. And when we're in film
So it's
season,
probably not happening right now.
it's not happening right now because it's pretty intense.
Mm,
You know, it takes a lot of
yeah.
work to make sure we get you out the right information.
Yes.
But it's coming back. It is coming back as soon as I
Okay.
can get through my many responsibilities, and film season takes
Yes.
up a lot of my evenings
Yes.
because I work during the day and I film in the afternoon. So
Yeah, and that's important to say. You're a working OBGYN.
working,
you are
girl,
you are
working.
a hard working OBGYN.
And you
It's
know,
not just
babies
being
don't
this
read.
OBGYN.
Yeah,
Oh no,
they
you're
don't
not
read
just
the
the
book as to
OBGYN on
what
TV.
time. Yeah,
They don't care. They rude.
right,
They
right.
come when they want
They
to.
will keep
They come
you
when
up
they want
all
to.
night long. Yes. But we
All night long.
definitely enjoyed Dr. Jackie's point of view because I think women are God's creation to the extra. You know, when they made man, he made him X and Y. He took the Y, he added that little extra, and he made us extra. And so, what we
Yes.
want women to know is there's something extra about us. You give us sperms, we make it baby. You give us
Yeah.
food, we make it a meal. You give us a house, whatever
Yes.
you give us, we multiply, we enlarge it, and we make it extra. And so we want to come back and give women a lot of information on just being a woman. And to be a woman is a big old job because you moms manage the
It's
kids.
extra. It's extra.
Yes, you manage husbands, you go to work. And then we're so busy building each other up that life is a lot for us as
Yeah.
women. Yeah,
Yeah, it is. It is. And I just, and that is why I so appreciate you being here. I don't take it lightly that you chose to spend this time with us because I know for a fact there are a million other things that you can do, need to do, probably will do after this. And so we just thank you for your time explaining the O to us. I
right.
know it's one of your
But
favorite
now,
topics and
Dr.
it's one of mine
Tiffany,
too, but
if
what?
you call me for anything, I'm coming. Anything at all.
I appreciate it. I
So
appreciate
you
it.
got to know that.
Likewise.
Yes.
Likewise.
But you
Likewise. We
women,
help each
give
other,
us
right? We help each
right.
other
And we're helping you
because
ladies
you
out
know
there
there's no
listening to
other
us
like our
right
sisterhood.
now.
Absolutely.
Yes, if you're listening to us right now, you want to improve your you call us at Wow Aesthetics for your O
Please.
shot. We'll be glad to. If you're
Please.
in any other area, there are tons of O shot providers out here. You can look them up
Absolutely.
and we'll get your right on, in
Yeah,
check.
we're gonna get that old orgasm
Yes,
going because
yes,
it's 2023. Ain't no reason for no woman to be walking around here without that O. And if you ain't got the O, go
exactly.
get it. Get that O
Go
shot,
get it.
okay?
Yes, absolutely.
To find out more about Dr. Jackie and to learn more about what she's doing, what she's up to with Married to Medicine, the return of Dr. Jackie's Point of View, speaking engagement, Delicious Skincare. We didn't even talk about skincare, so we absolutely have to have you back to talk about
Absolutely.
that and all the things. Be sure to follow Dr. Jackie on Instagram at the real Dr. Jackie and on TikTok. She's on TikTok
Yeah.
at Dr. Jackie MD. And don't forget, my producer will kill me if I don't say this. Please don't forget to like, comment, and subscribe to Intimate
Yeah.
Details with Dr. Tiff. I'm your host, Dr. Tiffany Davis Henry. I hope you enjoyed this show today, and I hope to see you back here next week. Ciao.
Bye bye.